everybody. I'm Sarah Sinclair, Managing Editor of Cannabis Health, and thank you everyone who's joined us so far for the second instalment of this series exploring medical cannabis and women's health. We really appreciate everyone giving up a summer evening tonight to be here and probably juggling busy family lives as well to be part of this conversation. So hopefully everyone will take something away from it, and we'll be talking about motherhood and delving into the experiences of mums who rely on medical cannabis, either for their own or their children's conditions. I'm going to keep this intro quite brief because there's quite a lot to explore in this one, and I'm really keen to hand over to our amazing panelists who are much better placed to speak about this subject than me. But I just wanted to give you all a little bit of context before we dive straight in. There's around 6,000 private cannabis prescriptions that have now been issued in the UK, while another 1.4 million people are thought to be self-medicating. Despite the law change in 2018, only 3 prescriptions have been issued on the NHS so far, and many members of the public, even some doctors, surprisingly, are unaware that cannabis is now prescribed for a wide range of conditions, from chronic pain and epilepsy to anxiety and PTSD, but many more outside those as well. So it's not surprising that many parents, particularly women, but men as well, experience stigma for accessing this form of treatment. In the lead up to this event, I was lucky enough to speak with several mums who access cannabis both legally and illegally, and almost all of them felt they had to remain anonymous. Most hadn't disclosed that they were a medical cannabis patient to anyone apart from their sort of very immediate family. And many lived with shame and the fear of being judged by others, and in some cases of criminalisation and what the repercussions of that could be for their family. One of the worst experiences I heard was from a woman who had a legal prescription being mocked by nurses after she told them she took cannabis oil, calling her, quote, just another druggie making excuses, end quote, when they thought she was out of earshot. Another lady was a full-time carer for her autistic son and elderly mother who found cannabis the only treatment which allowed her to function and control her pain enough so she could carry out her care duties. But unable to afford a prescription, she lived in constant fear of being caught, and which in itself took a toll on her mental health. Tonight, the aim is to create a space where women don't feel ashamed, where they feel comfortable sharing their own experiences and discussing the realities of being a mum, accessing medical cannabis, but also the challenges and mental health impact of motherhood in general. Tonight, we have another wonderful lineup of panelists, including one mum who needs absolutely no introduction, which is Hannah Deacon, an award-winning campaigner whose high-profile fight for access to medical cannabis for her son, Alfie, led to the landmark law change in 2018. Hannah now continues to campaign for fair access to medical cannabis treatments on the NHS and is the Executive Director of the Medical Cannabis Clinician Society and Director of Mapletree Consultancy. Hannah is also the co-founder and vice chair of MedCan Support, helping to support parents and carers of children who require cannabis medicines to manage their conditions. And she's committed to creating a patient-focused sector which will benefit other patients like Alfie. With Hannah is Gillian Flood, a mum of 6 and a patient advocate and member of PLEAS, Patient-Led Engagement for Access Patient Working Group. Since being prescribed medical cannabis in April 2020 for fibromyalgia and PTSD, Gillian's life has changed, and she now works with PLEAS to campaign for medical cannabis to be available through the NHS and to see an end to the stigma surrounding parents who take cannabis medication. And joining us again after last time is pain specialist at Integro Medical Clinics, Dr. Sally Ghazala, who specialises in managing patients with a wide range of pain conditions, and Sarah Higgins, clinical nurse specialist, who has over 10 years experience in the NHS in sexual and reproductive health services and is the women's health lead for CPASS Nurses Arm. So Hannah, I'm going to come to you to kick things off. I'm sure many of you know your story already, but if you could tell us a little bit about you and your experience with medical cannabis so far.
Yeah, of course. Thank you so much. And thank you to Sarah, Cannabis Health News, and to Integro Clinics for inviting me. And I apologise about the light shining in on my face. I've got a window just here and it's the evening sun, so I look a bit bright, so I have to apologise. But yeah, I will tell you briefly about Alfie's story. I think many people already know this story, so I won't sort of go into it too deeply, but I can also talk about the effects that my journey has had on me as his mother and how I feel about that. I don't I've actually never really been asked to talk about how I feel being Alfie's mother and the effects it's had on me. So I'm, you know, this is all new to me. So we'll give it a go. So yeah, my son Alfie was born in September 2011, and when he was 8 months old, he had his first seizure. I have no epilepsy in my family, no autism, nothing. It was the 27th of May 2012. I remember it very, very clearly still. And I'd gone to bed and I woke up at midnight hearing him scream. I ran into his room and he was having what I would now describe as a tonic-clonic seizure. So he was, his heart, arms, legs, everything going. His eyes were in the back of his head. I touched him, he was boiling hot. We switched the light on and he was going purple as well. So he wasn't breathing, and it was incredibly frightening. The seizure stopped quite quickly and we took him straight into our local hospital, which is Warwick Hospital. It's just a small, you know, cottage hospital, really. It hasn't got an intensive care unit or anything like that. They said to me he's probably got febrile convulsion, not to worry, but then it was very obvious very quickly that he was very seriously ill, and he started having very severe tonic-clonic seizures, which lasted up to 2 or 3 minutes every 15 minutes to half an hour, where he would stop breathing, and within a few hours he'd stop recovering between seizures. So he was basically in what's called status epilepticus. The hospital followed the epilepsy protocol, which basically meant putting a line into him and giving him a huge amount of antiepileptics, lorazepam, midazolam, clobazam, loads of other benzodiazepines and other drugs like that, which basically are supposed to stop seizures. But for Alfie, they didn't work. And by that Sunday evening, we had to go to an intensive care unit in Stoke. We were there for 2 weeks, where Alfie remained on an intensive care ward on midazolam for a lot of the time. I witnessed him. They couldn't find a vein, for example, because he had so many lines in him, and I had to be told to leave the room. And I witnessed him from the outside of this room having a line, central line, put into his neck while he was awake, which made him scream and made me cry very much. It was very, very distressing, very traumatic experience. I watched him have a spinal tap done, which is a very horrible experience as well, to watch your baby go through. Everything that he had to go through went against all my instincts as a mother to allow that to happen to him. But I had to keep telling myself that this was the only way to allow the doctors to do their job and to hopefully stop his seizures. But it was incredibly traumatic. Nothing helped him in Stoke Hospital, sadly. So I actually found my voice after 2 weeks of being in there, and I insisted that he was moved to a specialist unit, to a place where there were actually paediatric neurologists, where there wasn't any in Stoke. Sadly, we just had an intensive care unit, but no specialist neurologists, which apparently is okay, but I didn't think it was okay. So that was when I started to assert myself as his parent and think, you know, I need to actually start saying what I want to happen with Alfie. And my experience up until that point is that I didn't really feel very involved in his care. I know he was under a huge amount of, you know, it was an emergency situation, but I didn't really feel very, I didn't really feel like people were talking to me and asking me what I thought should happen or how I felt about things. And we certainly weren't offered any sort of mental health support for the whole time we were in that hospital. We were luckily moved to Great Ormond Street Hospital, and there the doctors were brilliant. We were under a doctor called Cheryl Hemingway, and she said to us, we're going to do all the tests again. And they actually did a test called oligoclonal bands, which is where you take blood and fluid from the brain at the same time, put it in dry ice, and they basically found loads and loads of white blood cells in his body, whereas when they did the normal virus tests, they were all normal. So it was a very sort of deep test that showed that he was having this immune response. And that's when they treated him with intravenous methylprednisolone, which is a steroid, and it worked, and he was diagnosed with immune responsive epilepsy at that point. But he had been seizing in intensive care for 3.5 weeks, non-stop. So we were very lucky that he survived that. We went home to our local hospital, and there we weaned him off all the drugs he was on, apart from a very low dose of low dose of oral steroids and a low dose of Keppra. What he was on, though, was morphine, and that was the one thing that was horrendous to watch my baby be weaned from. He went from crying to laughing to screaming. This is an 8-month-old baby, watching him wean from morphine was really, really terrible. He never slept, which meant I never slept. We were going, it was a really, really difficult time. And it started to make me question, again, the drugs that he'd been given and whether they were the right thing for him. And obviously, it's very important to understand that doctors that's all they have, with epilepsy. That's the only drugs they have at the moment. But it really was very horrendous to watch him go through that. Sadly, he started to cluster with those seizures in a similar format every 8 months until he was 4. And then it happened every 3 weeks when he was 4. And then by the time he was 5, it was happening every week. So by the time he was 5, we were going into hospital in an ambulance, always at night. So 2-3 o'clock in the morning, he was having seizures. We would have hundreds of seizures. We'd have to fill him full of anti-epileptics plus the steroids. The steroids are what stops his seizures, but they take about 3 days to work. So we'd have to use anti-epileptics to calm his brain down in the interim. And then we would bring him home. And then as he got older, he became very violent and aggressive after these clusters because they were happening so often and he was so much bigger. He would kick, punch, scratch, bite, go from screaming to crying to laughing to running into the road to being completely, unable to control his behaviour. And I was a full-time carer at that point. So my partner was working very hard to keep our house going. I had another baby called Annie when he was 3, because at that point he wasn't very severely ill. So we wanted to have another child. And so I was dealing with her as well. And it was he had absolutely no quality of life, absolutely none, and nor did I. And in 2016, to put it into context, he was in hospital 48 times out of 52 weeks. So I spent most of my life either in hospital with him or at home with him beating me up, which was very difficult. And I remember taking him into hospital, and the older he got, the more frightened he got and the more aware he got. And I used to dread it. I used to know, no, we're not going to find a vein. And sometimes doctors would take 10, 15 times to get a vein, or they'd have to get an anaesthetist out in the middle of the night to get a vein into him. And I got to a point where I just didn't want him to live like that. And I certainly didn't want to live as his mother like that. And it was a very, very difficult time, but it made me fight for him. And that's when I started to talk to parents who were in America and Canada who had children with the condition that Alfie has. So he was diagnosed at 5 with a condition called PCDH19. The reason he hadn't been tested for that is usually it's only girls that have that condition. So there's about 25,000 girls with that condition. There's 9 known boys with it. So it presents as clustering epilepsy, so not seizures every day, but big, very severe clusters of seizures, which always need hospitalisation and treatment. Mild to severe learning delay and behaviour problems. So very severe behaviour problems can be seen in people with PCDH19. There's very little research into it because it basically doesn't affect enough people to have a lot of money put behind research, sadly. And I think that's seen in a lot of chronic conditions. There's not enough money put into research for those conditions because the money cannot be made from the medicines that might be created. So when we were told Alfie had this condition by his doctor, I just thought, well, I probably know better than anyone how to treat this because no one can tell me how to help him. So I started to think, well, what does steroids do? Steroids suppress your immune response. It's very easy with steroids to understand what they do. They suppress that immune response. So with a lot of other drugs, we don't always know their mechanisms of action necessarily, but we do with steroids, it's very clear. They either suppress the myelin in the brain or they suppress your immune response. So I thought, well, what can we do that's natural that might do the same thing? And that's when I started to have conversations with parents in America with children with PCDH19 who were using anti-epileptics alongside cannabis very effectively. So either stopping seizures for long periods of time or reducing seizures and improving quality of life. I then decided to speak to my neurologist about it, and we tried to get on the Epidiolex trial, which is a CBD isolate product that was in trial in 2016-17 when I was speaking to him about it. We couldn't get on that trial because Alfie's condition wasn't recognised for that trial. And that's when we decided to move to Holland. And, you know, I would say the rest is history in the sense that we lived in Holland for 5 months. The Bedrolite, which we used for Alfie, worked absolutely amazingly. He's now at the moment 15 months seizure free, so it's worked incredibly well, and actually the longer we've used it, we've seen a better improvement in him. And we had to come home and we had to fight, and we were very lucky to work with End Our Pain, the lobby group on medical cannabis, who supported us hugely. And we met the Prime Minister in March 2018 and managed to work with government. And thank you to my friend and colleague, Professor Mike Barnes, who helped us to achieve that licence. And, you know, when the law changed, we were very happy to be part of that. But obviously, as we all know, it's not worked out how we like. So that's why I continue to advocate for it, because I really do know what it's like to live through hell and see your child suffer. And I don't want anyone in this country to suffer with chronic illness unless they have no choice. And cannabis absolutely is a wonderful choice to have. Yeah. So that's my story in a nutshell. I mean, I can talk a bit about how I felt personally about being a parent of Alfie, or did you want to have questions? I don't know how you
I was just going to say, I want to come back to what you said about the mental health impact there, because I think what you said about no one ever asking you about how you felt is quite powerful. But just before you did that, when you first sort of started looking into cannabis, and what was your opinion of it? Has that changed? And have you experienced stigma from other people as well?
Yeah, hugely. I was really worried about looking into cannabis, actually. I probably, like most people of my age, saw cannabis as a recreational drug. I never realised it was a medicine. What really helped is talking to parents in America. I've got especially one friend called Emily, who's got a daughter called Bella, and she really supported me. And that really, really helped me. But I was really worried about talking to my parents about wanting to use cannabis with Alfie and my siblings. But actually, I have been very lucky in the sense I've been brought up in a very liberal family, and I think, you know, if they did think I was mad, they never said anything to me. They were very supportive and helped me. For example, my mum helped me hugely to fundraise so I could move to Holland, and I've been very, very lucky with that. I was worried about parents at school. I'm inherently, whether people believe it or not, quite a quiet, shy person. I'm not very good at making conversation with people. At school, I was worried about that. I was worried about what people thought of me, but I had to put it aside. At the end of the day, I feel like I was in quite a beneficial position in the sense that I came back from Holland and I had to work with a campaign group to get access for Alfie. So at that point, the day I went on to BBC Breakfast I remember it, the 26th of February 2018 was my first interview. I had to get rid of any doubt about what I was doing at that point, because if I'd had any doubt, I wouldn't have been able to fight the way I did. So I remember very clearly just thinking, I've got to put any doubts aside. And actually, after seeing what it did for Alfie, I mean, moving to Holland was terrifying, absolutely terrifying. You know, four of us going there, no support. I remember driving from the ferry to find where we were going to stay. I remember the first time we had to take Alfie to hospital when we'd been there for about 3 days in the middle of the night. You know, all of those things were incredibly stressful, really stressful. I really feel sad that we had to do that, but I'm also really proud that we did that, because hopefully in time it's going to help many people access products who don't have to move abroad to access something that should be prescribed in this country. So it was very frightening, but I am very lucky that we had a huge amount of support, and I still don't really know what people think of me at the school gates, but to be honest, at the moment it doesn't matter anymore, because Alfie's really well, and that's all that matters to me, really.
Yeah. And if you're comfortable talking about it, if you wouldn't mind talking a bit about the impact on your mental health and what it's been like, both the whole process, but also just being a parent of a child like Alfie who has sort of disabilities. And if Sally and Sarah want to jump in at any point, like, feel free to kind of ask questions.
Yeah, I mean, it's very hard. I mean, any parent of any child with a disability will, I'm sure, agree that it's not what we planned. I remember many times being in hospital with Alfie, feeling very angry, very upset, very unseen, because I was a full-time carer, and I think I feel very passionate about carers, parent carers in our communities. I think they probably all feel very unseen, and they do one of the most important jobs that you can do is keep your child safe and out of hospital and at home and well looked after. And it wasn't what I planned. It wasn't what I planned. I planned to have a child like my friends and my sister, and they go to school when they're 4 and they learn to read and write and they have little friends around for tea. And none of that's happened for Alfie until he started cannabis, which is why, again, I'm such a big advocate for it. Like today, I did maths with him and he's sight reading words. He's writing down sums. You know, none of that would be possible if his seizures hadn't stopped. So, but there's a lot of grief. There's still a lot of grief for me, and I'm incredibly blessed every day that he's so well, and I'm very blessed that I don't have to pay a huge amount of money every month for his product, and I know how lucky I am for that. But that doesn't mean that I don't live with a lot of grief still about his condition, about how I wonder who he would be if he hadn't had epilepsy, and if he didn't have to take all the drugs that he took when he was younger that probably have damaged him. And that, you know, but I try and remain really positive. You know, that it's no point in me sitting there wondering what if. I spent a lot of many years doing what if I'd done this, what if I'd done that, what if he'd been different. But actually that's not going to help me. What is going to help me is being positive, looking forward, trying to help other people, trying to make his life as happy as possible, but also using his legacy to help me to help others. And I have a saying that my friend put on a picture for me, and it's at the top of my bed, and so at the end of my bed that I can see it, and it says, surrender to what is, let go of what was, and have faith in what will be. And that's my continued saying to myself if Alfie's ever poorly, which I haven't, thank God, had to sit and look at that sign, but if he's in my bed with me poorly having seizures, I just recite that saying to myself over and over again. And I just have faith in life, and hopefully things will be okay. But it has been hard, has been very hard.
I think it must be very challenging. I think most new mums face kind of a loss of identity when they become a mother, but then to have the additional challenges of being your child's advocate, navigating your way through a medical system, not just in the UK, but abroad, becoming the main carer, giving up more of your kind of other parts of yourself in order to fulfill that role must have been very, very difficult. And although I understand you have to be positive, I think it's a normal psychological process to question these things as well. And it's really sad that no support was wrapped around you for that.
No, and I felt very angry actually. We had a social work assessment about 3 times before Alfie was 6, and every time we were told Alfie's needs were not significant enough to require social care support. We did get a social worker before we went to Holland, because Alfie was so seriously ill, and we were very lucky to have doctors that supported us to go to Holland. Our member of parliament even supported us to go to Holland, which was fantastic. But as you say, we had to fight for everything, and I think we got 1 counselling session when we were in Great Ormond Street Hospital, and that was it. And I feel very, very let down about that. I feel very angry about that, because actually I think people assume that or maybe they don't, but I thought when you went into hospital with a chronically ill child that you would have that wraparound care, you know, someone would take care of your child, but also someone would take care of you. And I see that every day in the people that we come into contact with through Medcan support, is that parents are not being supported adequately at all. Especially mums who are usually full-time carers at home, they're not being given any mental health support at all, hardly, some of them. And they have children that are in palliative care a lot of the time that will not make a certain age. And that's massive. That's, you know, as you say, it's not what you expected when you have a child. When I had Alfie, when he was so poorly, Drew and my partner couldn't go out for dinner. We couldn't go out for drinks with friends. All the things that many couples take for granted, that you can just go to the pub for a pint together, you know, we couldn't do any of that. And we're very lucky to still be together. There's many mums I've met in hospitals on their own, caring for children who are chronically ill by themselves, because relationships have broken down. And again, that's incredibly sad. And I feel you know, as an aside to the debate about medical cannabis, I feel very strongly about families like mine who have chronically ill children, that there's a social actual construct of why we need to look after families better who have chronically ill children, because actually getting mums back into work, getting them to feel part of something, getting them to be able to pay their earn a living and pay their taxes and being part of the office environment, whatever, that's so good and positive for your mental health. If you're stuck at home all day by yourself with someone that you love more than anything in the world but that is seriously ill, it's so detrimental to your mental health. And that's really why I fought like I did to make life better for us. One, because I wanted to know if anything happened to Alfie, if he didn't make it, that I'd done everything I could as his mother to do everything. You know, I felt guilty enough, like we all do as mothers. I didn't want to feel any more guilt by not fighting for him enough. But also it was to make my life easier. I wanted to go to work. I wanted to feel part of society. I wanted to go out with my partner for dinner. And I knew unless I fought for a better life for us, then we wouldn't be doing that. I wouldn't be able to sit back and wait for someone to make it happen to me, because it had been shown to me for the past 6 years that no one was going to come to my rescue, sadly. Yeah. You know, that was my experience. And it's, you know, I'm sure not all families have that experience, but that was mine, and many others that I have spoken to have had the same experience. And for example, respite, we never got any respite. We had to fight for respite time. Apart from Alfie used to go for one day, I think it was one day a month, to Zoe's place, which is a place where children under 6 can go. But as soon as he got to 6, he couldn't go there anymore. And that was it, you know, and I think that's a lot of why I just sort of got off my backside and thought, right, I've got to fight, because, you know, no one was coming to our rescue. And it is sad. And I think so much more needs to be done to support families like mine with their mental health.
I think I totally agree that there's a lack of social intervention. And I think that we are missing a huge part of the wider impact and the ripple effect that a child with a chronic illness can have on the family as well as themselves. And I just wondered, in terms of Alfie's education, are they supportive of the use of medical cannabis? Have they educated themselves a little bit more around it as a medicine? Do they ever have to administer? Or
yeah, I mean, Alfie started at a special school in Warwick, near where we live, in last September, and obviously Alfie's medication is prescribed, and he has a dose at 3 o'clock. And before, when he was at a mainstream school, that was fine, because he finished school at 3 o'clock and we used to go and pick him up and to give it to him at home, because we live very close to our school. And when he moved to this special school, he was going to get the bus there and back, which he was very happy about, but he wouldn't be getting home until 4:15. So I was like, well, he's going to have it at school. And that really worried me, because I thought, oh my God. And I remember I wrote the school nurse, I wrote a big long, I remember handwritten A4 page saying, you know, this is Bedrolite, it smells of cannabis, it is cannabis, all this stuff, because I was so worried. And I was like, it's nothing to worry about. And she was brilliant. She just phoned me up. She said, it's prescribed, it's fine. And absolutely no problem. She was brilliant. School nurse is wonderful. And they're really fine about it. And that's been really refreshing. And I didn't, because I was sort of setting myself up for another battle. And the one other positive thing that happened to us very recently is when we found out that Bedrolite might not be available to Alfie because of Brexit. Obviously we had to go out on the campaign trail again and fight and get the government to intervene, which we're very grateful that they did, and that's still an ongoing issue and hopefully will be sorted by the end of the year. But I actually got a phone call from our local social services in January, and she said, oh, I've seen the story about Alfie's medicine. And I thought, oh God, you know, here we go, I'm gonna have hassle. And she was actually wonderful, and she said, this is a child protection issue. If Alfie doesn't get his medicine, we will intervene. And I was like, this is amazing, this is so refreshing. And so, you know, we were very grateful for that. So I definitely feel like the tide is turning in more, you know, a more positive light for some people, not all, but definitely for the people that surround Alfie have seen the benefits for him. And it's undeniable, you know, the benefits for him. He's been on this medicine for 4 years and it's changed his life. And he does, you know, to be very clear, he does still take antiepileptics alongside that. We did try for him to be just on cannabis, but his epilepsy is too severe not to be on antiepileptics as well. But he's been on a very low dose of antiepileptics now alongside his cannabis, and that works for him. And we don't see a huge amount of side effects from them. So, you know, it has been really positive, and we have been very lucky with the people that are involved in his life professionally. They've all been very supportive, actually.
That's good to hear.
Okay, Gillian, I'm just going to sort of bring you in now. Is there anything that you can sort of relate to from Hannah's story? I know if you are comfortable telling a bit about your journey, because it's sort of coming at a different perspective, but I think there's some common ground there if you want to tell them a bit about how you came to medical cannabis.
Yeah, I mean, I can totally like empathise really a lot of what Hannah's been saying, because my kids have got additional needs as well, albeit not as severe. It's not life-threatening or anything, but it is lifelong. So it's a lot of stress and grief and guilt and everything that you deal with. But like for myself, I suffer from like fibromyalgia and PTSD. And I had been on, well, before that, I had like depression and anxiety from my teens, from some stuff that I'd been going through, and the doctor straight away put us on like antidepressants, and then I'd been on loads and loads of different ones, and they just made me feel absolutely horrific. And so then I'd been looking at like talking therapies, but nothing was really seeming to work. And after I started having my kids, that's when like my physical health then started to kind of decline as well, but a lot of it was put down because I had like my kids all quite close together, so like my first 4 were all within 4 years of each other. So a lot like my back pain and joint pain and everything was getting put down to, you know, you put your body through a lot having the kids and stuff. And I'd just been taking like painkillers and things like that. And then after I had my twins, my health just kind of got worse and worse, and then I ended up, I kind of went numb down this side, and like the doctors weren't too sure what was going on, and I had to go for loads of tests, and that's when they said, oh, it was fibromyalgia, and they gave me like gabapentin to try for the pain for that, but that just left me feeling like I was really drunk, and I was like staggering about, I couldn't walk in a straight line. And so like trying to look after the kids who've got all these difficulties as well was just not happening. So like my husband had to pretty much take over everything, but like it was really difficult because I had been doing it like before, like when they were all young. So like when they were following the routine charts, like I was doing it all and everything. So then he had to like, you know, take over all that stuff and taking them to school and make sure they've got the right clothes, because they only wear the right clothes and all this sort of stuff. So eventually, like I realised like I just wasn't functioning at all as a person on the gabapentin. I tried the pregabalin and it was just the same. And so eventually I came to the conclusion that I was probably better just not taking these tablets and just try to like cope with just being in pain. But that again just didn't really work out very well for, you know, being a mum, and felt like I was missing out in a lot of their lives. Do you know what I mean? Like for one of them, I was too sick to go to their first day of school, so my husband took them, and you know, all these things, it's like you can't get that time back, you know, and I missed telling them bedtime stories, and I missed playing games with them, and it was pretty bad. And then I'd read online about medical cannabis being legalised and being available, and so I thought I would look into that. And from getting that, life just completely changed, like for the better. Like I didn't think anything could work like that. It was completely unlike any other like medicine I'd tried before, where like everything else I'd tried before just seemed to have all these negative effects. Maybe a little bit of feeling slightly better, you know, but I still wasn't able to do the things that I wanted to do or be the kind of mum that I wanted to be. Whereas on, like, you know, since being prescribed cannabis, it's been like I can get up, I can think clearly, I can help calm the kids down when they're having a meltdown. You know, I can do all the things that I need to be doing, which is amazing. But then it makes me angry of why couldn't I have had this years ago and not have had to have missed out in so much of my kids' lives and, you know, so much of my own life and, you know, taking things that just made me feel awful, you know, and that was your only option. But I feel like now we've got another option, but it's still, you know, so unachievable for a lot of people. Like for me, I can only afford half of my prescription for what my doctor wants to prescribe me because I can't afford it all. So although I'm doing better, I'm not doing the best I could be, you know, which is not great.
Yeah. And have you experienced stigma sort of since you started taking medical cannabis from other people in your life, or sort of other parents, that kind of thing, or doctors?
I've kept it pretty quiet from a lot of people that aren't like close to me. Those that's close to me have been pretty supportive of it. Even some friends that weren't quite so at first, that they were a bit kind of wary of cannabis, and they were like, well, you know, I don't like that and I don't like the smell of it and it's just a drug. And but after they'd seen the difference it had made to me, then they were like, oh, can you tell me a bit about that? And, you know, because they'd like, oh, it's nice to see you like taking the kids to school, and, you know, I've seen you out and about a bit more, and you know, so they could see the positives of it, which was really, really good. I've not spoke much to my doctor about it now, because years ago when I had seen a psychiatrist, and they obviously ask you, you know, do you drink, do you take any drugs or whatever? And I'd said to him, you know, I'd tried cannabis a few times and I'd found it helpful. It helped me sleep and it gave me a bit of an appetite. And I get told off him that that would only make my mental health problems worse, and that he wouldn't be able to treat me if I was going to take cannabis in any way. You know, and at the time I thought, well, I better listen to him. He knows what he's saying. You know, but then he was then wanting to put me on tablets that, you know, weren't approved for my conditions and things like that as well, and it had really bad side effects. So I still am a wee bit wary of like talking to like doctors and stuff about it, in case, you know, they still have that kind of attitude.
Yeah. Do you feel like you missed out on some of those years that you could have had kind of with your children and having those if you'd, you know, not shut it down straight away?
Absolutely. Yeah. You know, I think I should have just listened to myself and thought, right, well, if this is helping me, you know, I should just do it, you know, to be a good mum. But at the same time, when you've got kids with additional needs and social work involvement and things, you don't, you know, you're wary of breaking the law, you know, and you don't want your kids to see, you know, police in your house or anything like that, you know. So it's, you've got to make your decisions, you know, on what you're happy or not happy to do.
Yeah. And kind of where you are now in your life, obviously you're still dealing with a lot of challenges. You've got children with additional needs, you've got chronic health condition yourself. How does the cannabis help with sort of the mental impact of those? Does it help in more than just kind of managing the pain, for instance, of the fibro? Yeah.
That's been like the best thing about it, is like how much it's helped with everything, you know. Like before, when you're in pain all the time, you can't think clearly, you can't make good decisions, you know, everything just feels like it's on top of you, you know, whereas I feel like I've got a bit of breathing space, you know. In the morning I get up and I vaporise some cannabis and I just get a bit of clear-headedness, and I can actually think, right, what's on for today, you know, what have I got to do, and can I actually get it done, you know, and help my kids, because my kids find it really difficult to organise themselves, so they need a parent, you know, to help them with these things, you know, so that they're learning how to do it for themselves. And so it's been really, really good being able to do that.
Yeah. And how have they reacted to your kind of medical cannabis prescription? Are you open about it with them?
Yeah, because they could see such a huge difference anyway. You know, and I wanted to be honest with them, because I know that you know, a lot of them are at high school and things like that. So I know that they'll get told, obviously, things in like their PSE lessons about, you know, the dangers of cannabis and things like that they do in school. And, you know, I didn't want them to be hearing that at school and then not knowing too sure like what was going on at home. So I thought it was very important to be honest with them about it. And they're all really happy about it. You know, they understand that it's a medicine. You know, they understand that I'm not taking it just to, you know, relax. I'm taking it to feel better. You know, so they're all quite clued up on it now, which is good.
Yeah. Sarah or Sally, do you want to pick up on anything that Gillian said there, or Hannah, if anybody wants to sort of jump in, just go for it.
Can I say something? I mean, regarding Hannah, I mean, this is, I mean, to live with a child that having seizure every week is I don't know how did you do. I'm not a mother, and really, I'm sure it's horrible to have a life like this, and really well done to take it to this level to be prescribed in the NHS. And regarding to Gillian, I've seen a lot of women with fibromyalgia or patients with fibromyalgia. It's not just the pain, as the Gillian said, it's the whole thing. I mean, it's the pain, is the fatigue, is the tiredness, lack of sleep, the relationship with the partner, the relationship with the family. It's a huge chronic pain and chronic condition, but I'm talking about chronic pain because I'm a pain consultant. Is I see in my clinic is horrible. It can destroy a life. And if cannabis is helping, and I have seen a lot of patients in my clinic, they tried everything, every possible thing, with conservative management, with medication, with everything, and nothing helps. And they went to the cannabis clinic and they said to me, it's a life changer. The cannabis changed my life. And they take nothing except cannabis. And I am amazed because, as I said, I just started cannabis in the last few months. I'm new to this, and I was really amazed how a great effect of cannabis can be on my patients. And they tell me, I stopped taking medication. I'm just on cannabis and I'm happy. I'm a happier person. I can live a life. I can function. With all the medication like the gabapentin and this, they have horrible side effects. And yes, a lot of people, they stop because they can't live like this. I'd rather be in pain than having the side effects of the medication, as Gillian said, is what I've seen. So well done, really. I mean, that's what I can say.
Sally, have you seen a lot of parents in your clinic in sort of a similar situation to Gillian who find that they can actually parent better with cannabis than any of the previous medication?
You're talking to me or talking to Sarah?
Sorry, Sally. Yeah, and Sarah, to be honest, both of you.
Sally's probably a better place to answer that.
Yes, I've seen a lot. I'm telling you, I was amazed how cannabis helped with their medical, like fibromyalgia, neuropathic pain, lower back pain, affecting the sleep, affecting having an anxiety, lack of sleep can cause more pain. And a lot of them, they told me that it is the only thing is helping. And of course, there's still stigma around using cannabis. But some of my patients, they are very open about it. Yes, I am using cannabis. I am using medical cannabis, and it is helping me. And it is, I mean, if it is helping and it's medical cannabis, there is no harm of saying, because it is making people function and be part of the society, and less pain. And yes.
Sarah, do you want to go in? Yeah.
Sorry, Gillian, you said that you were on a few different medications that you came off of, and that it was actually more manageable to have the pain than to deal with the side effects. But actually you found cannabis helpful in managing mental health and pain. Can you remember how many medications you were on and how many you're on now?
Yeah, well, the antidepressants was only like one at a time, but because none had worked, they just kept on changing them, and that was like continuous from I was 15 till I was about 24. Wow. For that whole time. And then when I was about 25, I get prescribed quetiapine, which is an antipsychotic, which was horrendous. I think the only good thing about that is you can't feel anything at all. But for me, trying to be a mum when you have got no feeling at all is impossible. You know, I mean, I just did not care about a thing. So that was an absolute no-go. After that, I think there was, I can't remember, it was one that was some kind of anti-epileptic drug that they were trialling on people with PTSD. I didn't stay on that very long. The doctor tried me on lithium. And then it was gabapentin and the pregabalin. I think that's been about it.
And now you're on a medication that you find is beneficial to you and works for you. How comfortable are you talking about it with your wider family, with your friends, with your kind of mother network, support network? Is it something that you feel that you can talk about, or are you still a bit like...
I'm finding it easier to talk about it now because it's helped so much. So whereas like before, I was like really, really nervous about it and things, like now I'm like, I like how I feel now, you know. This can never be a bad thing, you know. My kids are happy, I'm happy. So I do have more of an attitude now of if somebody's got a problem with it, that's their problem, not mine. You know, or that's their prejudice, you know, and things like that, because I don't feel ashamed anymore. You know, I think this should be given to anybody that could find it helpful. You know, it shouldn't be you know, oh, if you've tried everything else and there's a last resort, you know, like, why should everybody have to go through so much pain and suffering for years before they get to the point where they're allowed something safe and helpful? You know, it's...
Yeah, I really relate to that, because I wonder if Alfie was given cannabis when he was a baby, if he'd not been given hundreds and hundreds of intravenous doses of steroids and midazolam, whether he'd be cognitively more able, you know. And again, I agree with you, it should not be a last resort. It should be very much in the doctor's toolbox to use when they feel fit, that they feel that it's appropriate, and it shouldn't be something of the last resort at all. So I do talk to my friends now, if they ever talk to me about a friend of mine the other day was talking to me about her friend who's got a son with very severe autism, and he's very, very poorly, and she's very upset. And I said, well, she should think about using cannabis. You know, I said, there's clinics now that provide it for children. And she's a very good friend of mine, and her face was like, oh, like that a bit. And I still get it now, but I still say it. I still say it to anyone. But I think people think that because you can use cannabis for basically anything because of the way it works. So it's not, it's not working on a symptom, it's working on a system. So therefore, if that system is causing side effects of any nature, then it can work. But people do not get that, and I think they think that, you know, when you sort of advocate for cannabis for everything, that you're some sort of nutcase. So I still sometimes feel that stigma a bit even with friends, but because I've seen what it's like. You said, Gillian, it's changed your life, it's changed my son's life, it's changed my life because of that. So I still always talk about it to everyone, and probably bore everyone to death about it, but you know, it's really important. The other thing I was going to say as well is that I've had quite difficult relationships with doctors before the ones I've got now. My last doctor, before our neurologist we have now, actually threatened me with social services when I talked to him about taking Alfie to Holland. That was very upsetting. He also said to me, and this is more about, there's nothing to do with cannabis, this is more about me being a woman, is that when I went in with my partner to talk to him about Alfie, I would always say, you know, my partner's, thank God, very easygoing and laid back, and I'm more of the sort of feisty one, go getter sort of thing. I think that's probably why we get on, but he is very chilled out. And I would always say to my doctor, you know, I think this, I think that. And one day he said to me, why don't you say we? Maybe you should talk about how Drew feels as well, not just you. This is Alfie's doctor. And I was like, well, it's not up to me to say what he thinks. It's up to me to say what I think. It's up to him to say what he thinks. You know, I don't speak for Drew, but that was very much like, he didn't like the fact that I think I was being quite assertive with him. I don't think he liked that. And I think, you know, that is probably just, you know, being a woman, when you're talking to a male doctor, they don't, you know, and then my experience, they don't like that. They don't like, you know, assertive women. They probably don't like assertive colleagues either, do they, Sally? But or Sarah. So yeah, that's my experience. But we are very lucky now. We have male doctors that work for Alfie, and they all listen to me. I think they have no choice. So
yeah. Stigma, I mean, Jerry, and I had a patient, she's fibromyalgia patient actually, and she started in cannabis, and I told her, do the company, or she's a director. She said, yes. I called them, I'm in medical cannabis, and they were very supportive. I said, well done, you. She said, yeah, everyone knows I'm in medical cannabis.
Yeah, I think once you say it once or twice and you get used to hearing it coming out of your mouth, it becomes easier and easier, and you become less bothered about gauging what somebody's reaction is to that situation. But I suppose we're all only human. And I think something that keeps coming up in terms of motherhood or women using cannabis is social services. And I think it is probably every mother's worst nightmare to kind of have that worry or over their heads. I think clinicians become a bit worried about what to do with the information, and don't always react in the right way. But maybe we need to engage social services more around these conversations as well.
Yeah, definitely.
So
I think the reason that our doctor said, if you talk to me about cannabis, I'll need to engage with social services, because of his stigma, because of his lack of education, because of his fear. And that's why, you know, I feel so strongly that educating health professionals is one way in which we can stop this stigma, because actually patients listen to their doctors as they should. Patients, you know, the nursing staff at our local hospital were part of my family, to be honest, for many years, because I spent more time with them than I did with most other people. And they were brilliant in the sense that they didn't make me feel that there was stigma there. They may have been, but they never made me feel. But I have felt it a lot from doctors, and I do think it's because of fear, because they don't understand it, and they just see it like all of us have been told, you know, all in our age group, that cannabis is dangerous. You know, we've been told that for the last 70 years, and it's very, very difficult to undo that stigma. And the only way we can change it is through education, and also through patients talking to their GPs and their doctors about taking it and what improvement it's had. Because I think, and that's quite frightening to do, but I think it is really important that patients are telling their doctors about the improvements if they are accessing it privately, or not. But, you know, they should be talking to their doctors about how they're feeling.
Yeah, I think it will make it less of a hot potato when that information comes to you as a clinician. It's not so like, oh, I need to hand it over to somebody else. Yeah.
Yeah, Gillian, do you speak to your GP or your doctor now that you're obviously seeing the benefits? Have you spoke to them about it, or do you still kind of avoid it?
Yeah, I've kind of avoided it, but that's mainly down because of, like, obviously COVID and things, and so the doctors haven't, like, been properly open, and I know they're under a lot of pressure, you know, just dealing with life at the moment, being crazy. I think if it hadn't have been for COVID, I would have been down at the doctors quite regularly, I think, telling them, you know, I'm feeling a lot better. I spoke to them once because I was just worried about being able to continue to afford my prescription. And I was saying to the doctor, you know, what options do I have? You know, if I can't afford this, you know, what can you do? And they basically told me they couldn't do anything for me. And I said, well, can you refer me back to the pain clinic? And I was told, no, they didn't see any point because I was unwilling to take the tablets that they wanted to give out. You know, and I said, well, is there anything else you can do to support me? And was just told no. So it's
so incredibly sad, because they are able to legally, under direction, if the GPs prescribe. That's what upsets me. I think maybe they don't even know that. You know, they you know, I think that's the thing. A lot of doctors in the advocacy work that I do, a lot of doctors and trusts, I still don't think they know what the law is. You know, it hasn't, you know, when the law changed, the government changed the law, but that's all they did. They haven't disseminated information to CCGs or to trusts about funding. They haven't they haven't, you know, changed legislation. They haven't looked at the way, you know, the driving laws, all that sort of thing. There's so many things that haven't been changed, even though the laws change. And I think, again, that's something that really does need to change, because the fact of the matter is that your pain consultant could instruct your GP to prescribe, and that's the law. But sadly, you know, they just either say no, they can't do it, or they won't do it. And I think that's incredibly sad when it's the one thing that's helped you. It's awful.
Yeah, I mean, I even asked my doctor at the clinic that I see, you know, is there any chance of this coming out, you know, for the NHS? Could you get my doctor to prescribe it? And I was just told no, wasn't possible. You know, but it seems really strange how, you know, a doctor can prescribe it if I pay them, and, you know, if I don't,
well, exactly,
then they can't. Yeah. You know, and that's just, it's really unfair.
But also,
you know?
as well, for me, when you see the drugs that children are given with epilepsy, and the fact that there is actually no randomized controlled trials in many of the drugs that are given to children, full stop anyway, whether they have epilepsy or not, it's done on what they call historic data. And I just don't, you know, having seen the way my child has been because of some of those drugs, and he, you know, he was advised to go on gabapentin, and we never put him on it because I just read it up and I thought, I'm not putting my child on that. But, you know, I don't
either if I'd read up on it first.
I don't understand, you know, maybe Sally, you want to talk about, you know, that sort of mindset where a doctor feels comfortable prescribing something like that and doesn't feel comfortable prescribing cannabis. Do you, I mean, obviously you probably can shed some light on that. I don't, you know, I find that hard to understand, but maybe it's the way you're trained and the way, and sort of within that group, it's sort of, it's what you do.
Yeah, I mean the training, like as I said, the last, we never learned anything about endocannabinoid system. I didn't know anything about it when I was in medical school. I started to learn about it in the last few years, basically, that something does exist, and there is not enough. I mean, we didn't use it. We don't know what is cannabis, and that's why less comfortable prescribing something that we don't know about. And the other medication that they are used, as I said, from to years, and you are more confident in prescribing something had trials on them, and they've been prescribed by years and years and years. And that's, as you said, is just the lack of education in a way, and that I didn't know anything about the the system and how it has effect on the body. Yes.
And how's your perspective changed since you've learned about that, and the way you sort of approach medicine now? Has that changed? Yeah, Sally.
I start to say to my patient, like fibromyalgia and clinic, I tried everything, and I totally tell them very clearly, did you prescribe? Did you try medical cannabis? And some patients, they said, no, we don't. I said, yes, you can go and try medical cannabis. It's something that we can prescribe. Maybe it will help with the symptoms. So since I started writing medical cannabis, and since I started seeing the huge change on my pain, my patient pain and everything, I started to tell my patient, yes, you can try the medical cannabis. It might help with the symptoms. It did change, actually. I have to admit, it did change my practice.
Sarah, do you want to add anything from sort of a clinician's perspective, kind of why doctors or, you know, NHS staff might be hesitant about cannabis medicine?
I think it's lack of education, and it's kind of education, removing the stigma and everything that we've been taught up until now. And it's just about reframing it as a medicine, which is going to take some time. But I think the more we have these events, the more campaigners there are, the more prescriptions that are written and patients are able to talk about the benefits of them, then that should help influence clinicians to work more in a patient's favour.
Yeah, I was just quickly say that I know, you know, we obviously all want to see NHS prescriptions, that's what we all want, but actually having a private sector with 6,000 patients, soon to be 7,000, 8,000, 9,000, is actually really positive for change, because those people will be speaking to their families, their friends, their doctors, and saying how it's improved. And as you say, Sarah, that's how we change things. We educate, we discuss, and we prescribe. And having that private sector, whilst it does mean sadly some people can't access product, it does really help move things forward, because all those people who are having positive effects are going to be talking to lots of other people, and so that, you know, that's going to change people's perceptions of cannabis as medicine as well.
Definitely. And the more trials that we can get right, Hannah, with people that then can get on them, that makes it affordable for them, then it's a way of kind of opening it up to more and more people. It might work like this for some time, but eventually it will trickle over.
Exactly.
It'll take time. Yeah, everything takes time.
Yeah, and obviously that's kind of on a wider societal scale. What about sort of the day-to-day interactions and sort of mums in the playground? How do you think we sort of slowly chip away at those stigmas? Is it just the same thing, education and talking to people about it?
I think mums in the playground can be a tricky place anyway. I don't know if anyone's looking on mums back there. It's not a great place to be. So I think you have to take it like everything else in the playground with mums, the same way you might take not getting invited to the party or what that mum says, just with a pinch of salt, and kind of move on from it. You know, you'll find your real mum friends like anything else. And it's hard. It's really hard to find that confidence. But you should try not to take it on board too much.
Yeah, I think you're absolutely right, Sarah. I've always found being in the playground difficult anyway, because I'm not someone who goes up to people and says hi. It's just not in my nature. I find that really uncomfortable. But I also think what has helped is doing the campaign work that we have done and other families have done, and doing the sort of This Mornings and the Loose Women's and all that sort of stuff, because that's the sort of programs that a lot of mums at home are watching. And it's, again, that's going to be reducing stigma because it seems more mainstream and more normal. And I think the public by and large are probably sold on cannabis as medicine. I think it's very much more the sort of the doctors' societies and the higher echelons of the clinicians in the NHS that are the ones that need convincing more probably than the mums in the playground. But as you say, Sarah, that's a difficult dynamic anyway when you haven't got cannabis in the mix. So.
To be fair, I don't think there's a woman that would walk a mile in either of your shoes that would not have considered or taken the same routes that you guys have, you know. And that's really it, isn't it? Until you've walked a mile in somebody's shoes, you can't pass judgment.
No. And I think that's one thing that is so important that people do without even knowing is judging. And actually judgment is really sad and actually dangerous, because most of us don't really know anyone and what they've experienced. And as you say, everything I've been through with Alfie, I just wouldn't. I try very hard not to judge anyone, because people have their own hidden battles every day of the week that they're going through, whether it's their parents are ill or their children are poorly or they've got mental health problems or whatever. And that's why, you know, it's really important to not judge, and you know, social media doesn't help that, sadly. But you know, I think being in the school playground, it's, you know, there are mums that are quiet, and people always think people that are quiet are grumpy or moody, and they're not. They're just inward souls usually thinking about something else or what they're going to cook for dinner or whatever, and it's nothing personal. So it's
just with you mentioning social media there, Hannah, how do you cope with, obviously you're kind of dealing with judgment on a much bigger scale than most people. How do you cope with judgment that you get through those platforms, and have you found a way to sort of deal with that?
Well, that's an interesting one. I used to do a lot of blogging on my Facebook page called Alfie's Hope, and I used to really get a lot of benefit from that. I started doing that in 2017, where I'd talk about, you know, what it was like to be the parent of Alfie, what I was trying to achieve. I was trying to get him, you know, cannabis on the NHS, that sort of thing. And I used to do it a lot, and I used to get lots of really good feedback. And then in 2019, when we tried to wean his anti-epileptics to see if he could just be on cannabis, he started to have rebound seizures, and that was really, really distressing. And it took us about 10 months to get back on top of his seizures, which we have, and since then he's been seizure free for 15 months. But I did a video thing on my page, and I used a form of words where I said, I just need to be honest and open about this. And what I was talking about is the fact that I wanted to be honest and open about how I was feeling, and it was really big for me, and I was actually crying on this blog. And then 2 days later I got a phone call from the Mail on Sunday saying they were going to do a story about me and that I hadn't told the truth. And I don't think the Mail on Sunday look at my page, so I think someone had watched that and told them about it who was trying to cause trouble for me, which made me really upset. And actually from that point I've only done 1 or 2 because it really actually upset me. So I'm sort of not very, I've sort of withdrawn myself a bit from social media in that sense. I do my social media, I think it's really important to connect with people and get it out there, but I'm, you know, this is probably the most sort of open and personal I've been in a long time in this webinar, because I have to protect myself, because, you know I have been on this massive personal journey in the last 9 years since I had Alfie. I threw myself out there. I've tried to help him, and I also understand that when you throw yourself out there and you become an advocate for this and you go on TV, then you also give what people think is the right to have judgment and to have a position about you. And I don't mind that if people get to know me. What I don't like is if people don't know me and they make judgments about who I am, and that upsets me. But what I don't do, and I wouldn't do now on social media, is if someone says anything against me, I just ignore it, because actually you are never going to convince someone that they're wrong on social media. Even if they know they're wrong, even if you know they're wrong, you're never going to do that. So I don't do that. I don't, I have seen lots of things on social media which I think are wrong, which I don't agree with, which irritate me, but I never post and go, you're a pain, or I don't agree with you, or whatever, because I don't see the point. There's no point, because people aren't going to go, oh yes, sorry Hannah, no, I think you're perfectly right. They're never going to do that. So I just, I keep it at arm's length. I use social media for my work, but I'm less open on it, which does sadden me, really saddens me. I wish I had more confidence, I suppose, just to say, sod it, I don't care what people think, let them write stories, whatever. And it's not that, I've got nothing to hide. It's the fact that I just don't want hassle from people, because I still find life hard sometimes. I still have difficult days with Alfie, I still have grief, I need to protect myself and my mental health, because I have struggled a lot with very severe anxiety type PTSD symptoms from when Alfie was in hospital all the time. So I have to protect myself. So yeah, that's, I deal with it day to day, but I do try to sort of rise above it, use it as a tool, but I don't get too sucked into it.
Yeah. Gillian, I don't know what can you relate to any of that? What's your relationship like with social media? And since you started working with Plea, have you kind of been vocal on there at all about it, or do you kind of take a similar approach?
Yeah, I'm not on social media a lot. I'm quite wary of it because I've heard of other people pretty much getting ripped apart verbally on it, and I don't think I could deal with that very well. So I don't really tend to engage much with it. Even through Plea, like I don't do a lot with the social media side of things. It's just I think I'm a bit old for that sort of thing. I'm not very good with tech, I had to get my kids to set up my social media for me and things like that. I'm much better going out and actually talking to people in real life. I find that a lot easier.
I completely agree with you, Gillian. If I get the opportunity to meet people, I'd rather do that and talk to them and actually have a conversation and even have a debate. I'm happy to debate someone in person. What I can't do is do it on social media when I don't know who they are and they've never met me and I've never met them. It doesn't make me feel comfortable, and I agree with you. And to be honest, if I wasn't doing the job I was doing now, I probably wouldn't be on social media at all. I've got quite a few friends that have actually removed themselves from social media completely because of you know, difficulties or judgment or whatever, you know. So I think it's really positive. I mean, I don't live where I grew up, so I use social media as well to keep in touch with people that are friends of mine and things from where I lived. But you just have to manage it. Like my partner says, you have to know when to switch it off, which I think is really important.
Definitely. Just before we move, because we've got a few questions in the chat, but just before we move on, does anyone want to sort of talk about anything else? Or Sarah and Sally, do you want to kind of ask any more questions for Gillian and Hannah?
No, I'm quite interested to hear what the audience have to ask.
To ask Gillian, are you just on cannabis? You don't take any anti-neuropathic pain medication, nothing, just the cannabis?
Just cannabis, yeah.
And is it totally helping with the pain, with the sleep, with everything, with the fatigue and everything?
Yeah, I mean, I still have problems with pain, like I say, but I think I had one month where I could get my full prescription of oil and flower, and it was honestly, it was the best I'd felt. It was brilliant because I had the oil working away in the background, you know, and I could use the flower when needed, but it wasn't sustainable for me at all. So I only use the flower now, which is great because it works really, really fast, but at the same time it wears off really, really fast. So if I'm out and I can't use it, you know, all my pain's back and everything until I can use it again.
So that the oil and the flower were the best for you because of, yeah.
Yeah, I found that was the best because the oil on its own wasn't helping me in the morning because it could take like a couple hours to work. Yeah. So I was getting up in the morning and taking that. I still couldn't get my kids ready for school, you know, whereas now I can, you know, have my flower as soon as I wake up in the morning, and that really, really helps me to get out of bed and get started. But it's just, you know, I need to do that every couple of hours, you know, and so if I'm out for the day with the kids and if I'm with people that I don't feel comfortable having it around, then I've just got to deal with being in pain again, you know, or not go. Whereas obviously if I had the oil as well, I wouldn't need to vaporise quite so often, you know, and so I could maybe go out for longer and it wouldn't be, you know, even an issue about medicating in front of people.
Yeah. Are you sort of comfortable medicating in front of people now? Is that kind of changing the more comfortable you get, or do you still feel a bit uneasy?
I'm comfortable around like my immediate family and very close friends. Other people I'm a wee bit more not so sure of, or some family I don't know how they would react.
Yeah.
You know, and so it's just a bit difficult.
Yeah. Well, just moving on to the questions in the chat, the first question that I've got for both of you is how you each deal with the stigma. So that kind of leads on quite nicely for what we were talking about. Gillian, do you want to go first?
I don't really know, because I mean, a lot of the stigma I'll try and avoid it if possible. Like, you know, for people that don't need to know, then I won't say anything, you know, or if I think they're going to be pretty judgmental, I won't say anything, but I'd like to not need to feel that way, you know, but I really do feel like until it's more widely available, you know, people aren't going to know, because like if I do say to people just now, they'll be like, oh, you can get it on prescription. I'll be like, yeah, but then when I tell them they've got to pay for it, and they go, oh, but you've got to pay for it, and it's as if that makes it different, you know, and I'm like, well, it's still prescribed, like it's still legal, you know, but I feel like a lot of people who don't learn about it, then they don't really get why it's got to be that way. You know, they're like, well, why can't you just get it off your doctor? Or they'll say, oh, well, I asked my doctor and I couldn't get it. And then you've got to say, well, yeah, that's because you've got to go to, you know, a specific clinic and things like that. But I feel like, yeah, stigma will be an issue until it's, you know, there's better access.
Yeah. I think I feel actually very lucky that it's, in the sense of the stigma, that it's not me that's the patient, it's my son, because you know, I think if it was me, I'd find that stigma a lot harder, but because it's my son, because we lived in Holland, because we saw the amazing change in him, where he went from having hundreds of seizures a week, being in hospital most of his life, to not doing any of that. That gave me such a fight to actually not really care what anyone thought, because I knew, I'd seen it in with my own eyes what this medicine can do. And because I had to do all the television and the advocacy and everything, I sort of really had to just jump in, you know, head first, really, and just, you know, not think about people judging me, because I just didn't have that time. But I think that was a lot easier because it was my child and not me personally. And as I said, I'm very lucky to have been thoroughly supported by my family and my friends, but you know, even my partner plays rugby, and some of them are, oh, is Hannah the drug dealer? Which isn't funny at all, but that's what they, you know, they're just rugby players, and anyway, just ignore them. But you know, they think that's funny, and it's not funny. And I say, well, it's not, that's not funny, because that's nonsense, because you need to talk about it. It's a medicine. And you know, they think that's funny, but it's not funny. So there is definitely still stigma there, but I think it's more just lack, you know, it is lack of education, lack of understanding. And you know, we just need to continue to educate people and fight for what we think is right. And as you say, I think with access, then that stigma will stop. But you know, I have been lucky in the sense that I've just had to not as you say, avoid it, not think about it, and just do what you think is right.
And what would each of your messages be to other mothers exploring medical cannabis as a treatment option, either for themselves or their children?
Go, Gillian, or?
Sure. I think it would just be like, don't be scared of it. You know, it's a safe medicine. You know, and like I know of other mums that do take it and keep it quiet and don't tell anybody because they're frightened. You know, but I think it's, you know, we need to speak up about it more and say, no, this is helping, and you know, if this is a treatment that people are wanting to go down, then you know, they should be able to do that.
Yeah, I definitely agree with you. That I used to get contacted by hundreds and hundreds of parents all the time online wanting help and support, and I still do now. And that's why I helped set up MedCan support with Matt Hughes, who's a parent of a little boy called Charlie with epilepsy, because he was doing the same. You know, he was getting contacted all the time by parents wanting help and support. And you know, I think that's why we brought everyone together, to give them that help and that support, and to make them feel that they're not alone. But absolutely, I think when you've seen your child so poorly, and when you've seen them take some of the pharmaceuticals and what they do to them, I think, you know, absolutely, I would always advocate for trying medicinal cannabis. But one thing I would say to parents as well is to, and you know, to all people, understand the endocannabinoid system as much as you can, understand the products, because we find that now is that some people are prescribed products and they don't, you know, that's a absolutely side issue. You know, there's not enough transparency with products that are supplied in the UK. We don't actually know what's in them for a lot of these children. They don't even know what the carrier oil is. They don't know what the minor cannabinoids and terpenes are in there, if any, and we need to make sure that we have that transparency. But if parents educate themselves, they understand to ask those questions. And I think with normal, you know, normally when you go to the doctor prescribes a medication, you get the medication from the pharmacy, you get an insert, you know what's in it, you know the side effects. You don't get that with this unlicensed medicine. So the one thing I would also say to anyone interested in using cannabis for their children or for themselves is to try and do as much research and understanding as you can about the products that you want to use or might want to use, and ask questions of the people that are providing them to you, and make sure you understand exactly what you're taking, like you would with any other medication.
Yeah, that's really helpful. Thank you. And to Sarah and Sally, how would you recommend women like Gillian and Hannah approach their medical teams about accessing cannabis?
Sarah, you start.
No, it's okay. After you, Sally.
I think, as you said, I mean, as Hannah said, is educating the women and reading about it, and the webinars like this, and yes, and of course educating the doctors about the endocannabinoid system and the cannabis, because a lot of doctors, as Hannah said, they still not comfortable prescribing cannabis, and because of lack of education maybe, and maybe still the stigma around cannabis, and to prescribe cannabis for patients with chronic pain. Yes, so this is what I can say, really.
Sarah, do you want?
Yeah, I would advise drawing on support. So whether that's the support of somebody in your immediate family or a patient advocacy service, somebody who's able to prompt you and help you remember the points that you wanted to get across to the clinician. I mean, we've all been to see a doctor where we felt kerfuffled halfway through a consultation because they've said something and it's like, oh, now I feel about that big. But it's just about trying to drive what you would like to try or where you'd like to be referred, and being persistent and determined with that, and making the clinician-patient relationship a partnership rather than an autocratic setup. So that's what I would say, draw on support so that you're able to achieve that.
If the patient and the doctor partnership, as you said, and talking about cannabis, but if the doctor doesn't know anything about cannabis, so first of all we have to teach the doctors first. Do you understand? Yeah. Maybe the patient, they want cannabis and they learn about, but there is lack of knowledge.
Yeah, but if you don't have the knowledge, Sally, then you should acquire the knowledge to refer your patient on. I might not know everything in my speciality, but I should know where to put my patients or where to refer them on to.
You do,
as
yes.
well.
Yes, yeah. You're on to others. I totally agree, of course, yes.
Okay, and Gillian, have your children noticed a big improvement in your health now you're taking cannabis?
Hugely, yeah. They've all said about the difference it's made to me, you know, which has been, it's been nice and sad, you know, because it's great that it's made a difference, but then I just get sad about all the lost years as well. So it's kind of, it's a bit of a two-edged sword sometimes, you know, but then I've just got to focus on the future, you know, and right, well, you know, that was all then, and you know, we can work on things being better now.
I think that's the key to anything like this. Is I spent many years, as I said, living in the past, the what ifs. Why didn't I do that? Why didn't I do that? What if I'd done this? What if I'd done that? And I've learned to live in the moment. And I think living in the day is so important. It's so hard because actually, if we all check ourselves, all of us live in the past or the future most of the time, because we're all worrying about what's happened, or we're worrying about what has happened. And living in that moment, and like with Alfie, I don't know when he's going to start having seizures again. It might be tonight, it might be tomorrow night, it might not be for another year. I just don't know. And living like that does cause severe anxiety, but I really try hard to live in the moment. And we've had a really good day today, and he's been happy. So whatever happens up until this point, life has been good for him. And that's, you know, but it is very, very hard to not to live in that moment, but it is so important because you can't change the past and you don't know what the future brings. And that's very rational saying that. I know that when you have mental health issues, it's not rational at all. It's very irrational a lot of the time. But that's how I cope with it. I just try to live in the moment and be thankful for every good day. And it has made me realise a lot, actually, that, you know, when I was younger, I think you think that your life is sort of guaranteed in a way, and it's planned, and you just think that it's going to carry on the way it has. And then when this happened to Alfie, it really made me realise actually none of us know what tomorrow brings at all, and it's so important just to make life count every day if you can. And I know it sounds a bit cliched, but it does teach you that lesson really when you go through something so difficult.
It is very, I'm sure it's very hard for you, Hannah, really. I mean, you don't know if he will have seizure tomorrow or the next, or after a week or next. I mean, it's really horrible.
Making the most of it, because you don't know what's around the corner, sadly. But
you're right, you have to live in the moment, because what if I don't have kids and I say to myself, oh, what if then this, maybe I have a better life now, or what is, and I'm worried about the future, and I think everyone worries about the future, but I think, yeah, you have to live the moment and just enjoy what you have.
Yeah, you do, really, because otherwise you just,
yeah.
I felt in my life I was always waiting to get to that point. Do you know what I mean? Like, when I get the better job, when I have children, when I meet the right partner, when I do this, then I'll be okay.
Yes.
And actually you'll never get there because you don't actually know where you're trying to get. So you just got to sit in for the ride, I suppose, and sit in the moment and sit in the day, and actually have faith that wherever you end up is where you're supposed to be, and that is what will bring you happiness.
Yes, you have to. Yeah, you're absolutely right. I agree, Hannah. Yes, absolutely.
Yeah, I'm glad that I feel okay just now, and because like my kids are going through loads of changes with the ages they're at. You know, I've got kids that are leaving school, and I've got kids that are going to be starting high school soon, and you know, ones that are starting to work, and you know, and it's just been good that I can like be with them through this and help them to make like the choices that, you know, because they're all going through these big kind of teenage choices in life, and you know, I'd have hated to have still been, you know, stuck in my bed and in pain and not be able to kind of, you know, like be on the wee journey with them, sort of thing, before they're totally growing up in a way. So you don't get that long at it.
Yeah, absolutely. That feels like a really nice place to end. Just before we go, I'm going to come to each of our panelists for something that they'd like the audience to take away from tonight's event. So I'm just going to go in the order on my screen. So Sally, if you'd like to start.
Yes, so no stigma and no judgment, and educate doctors about cannabis and the effect of cannabis for my specialty, chronic pain, because I've seen the difference in most of my patients, really.
Yeah, Gillian?
I think my thing is just, you know, there's so many people need access to this plant that's safe, you know, and I think that's really important to me, is, you know, rather than trying to push things that, you know, aren't as safe.
Yeah, Hannah?
I would say anyone out there watching who's struggling with anything, with life, with their mental health, with needing to access cannabis, then I would always think of my saying, which is surrender to what is, let go of what was, and have faith in what will be. And that has got me through the last 9 years and continues to get me through every day. So keep that saying and say it to yourself when you're having a bad day, because it really does help.
Thank you. Sarah, what would you like to add?
Is just think about the impact of your words and your actions that you may have on somebody, whether that's as a clinician or as a friend or as somebody online writing a comment, you know, just think about it before it leaves your mouth.
My parents used to say to me, if you can't say anything nice, don't say anything at all. And I think we should all remember that one. Definitely, Sarah.
Yeah, I think absolutely. I think that's a pretty good note to end on. Thank you everybody so much for joining us tonight, especially our panelists, who I know everyone is really busy, so we really appreciate your time. And we'll be sending around information tomorrow with information about all of the organisations that have been mentioned and involved in tonight's webinar. So if anybody would like to find out more, they'll be available, and the whole webinar will also be available to watch soon on Cannabis Health and through our other partners. Yeah, I hope everyone's enjoyed it and felt like it was a nice, productive conversation. We'll hopefully see you at the next one. Thank you very much.
Thank you, Sarah.
Thank you.
Thank you.
Bye.